for that. Good evening, everyone. My name is Paulina Villanueva, and I am a PGY3 vascular surgery resident at The Ohio State University. And today we'll be speaking about important things to consider when choosing a residency program. Keep in mind that the relative importance of these factors will depend on the person. Residency program location is consistently ranked as one of the most important factors that affect residency selection by most medical students. Wanting to practice in a certain geographic area may be related to access to family and also a belongingness to your community, as well as a desire to work for this community after completing residency. The next three factors, academic versus community practice, program volume, and program size, I group together as I believe that these three factors combined create a program type. With these, some of the important components of these include the reputation of the program. Higher ranking or a perceived reputation may facilitate your ability to transition into an academic practice after residency. The number of hospitals that you will cover, academic programs may cover several hospitals, and this is directly related to the amount of resident coverage that is expected from the residency program. The resources that you have available, including the variety of rotations that are offered to you. Other factors like, for example, the availability of statistical support as well as resident wellness programs may be associated with the larger hospital. Training duration. So vascular surgery and general surgery are generally 5 years of clinical work. However, several programs have implemented 1 or 2 years of research. If this is something that fits into your timeline, then this is something to consider. However, if no research years are offered, are you still able to participate in research during your clinical years, and how is that integrated into your training? And then moving forward to other aspects such as open versus endovascular cases and the complexity of cases. Generally, higher complexity cases are associated with academic institutions because these may be associated with having extra resources, like, for example, specialized intensive care units that are able to handle more complex patients. And then fellowship. So obviously academic programs are generally associated with having fellows, and how is the integrated residency program, if they have fellows available, how are those two programs merged together, as well as the residency size. Do you want to be part of a large residency program, or do you prefer to be one of 5 or one of 10? Obviously there's benefits to both depending on what aspects of your training you're looking for. The next two factors are program benefits and the cost of living. So evaluating the overall value of your resident benefits. These include resident stipends, right? So most resident stipends are generally the same around the country. However, certain programs may offer you more money, but this is generally related to a higher cost of living. Health insurance is generally provided by most programs. Parking and meal stipend can be variable, and hospitals in larger cities may be unable to provide parking for you or have free parking available, and this is an additional expense that you have to account for, as well as the availability of food and meals when you're on call. Protected education time is also important. So how is this structure for your program? How many hours per week? And who is covering your clinical duties while you are in your education, your educational activities? And lastly, how many days a week or how many weeks of the year do you have off? What happens around the holidays? Do you transition into a 5 days off, 5 days off schedule? And I think these all kind of play into your the benefits of the program. The next two are the call type and the rotation schedule that you have. So will you participate in a model that practices a golden weekend in which you work 2 weeks and then get a week off? Work 2 weeks and then get a weekend off? Or are you in a program that will be 1 day off or per week average? When you are taking into account your junior call, are you taking vascular junior call? Are you taking general surgery junior call? Or are you taking both? Because these can affect, obviously, the number of hours that you'll be working. And then as you move forward in your training and you transition into your senior call, is this in-house call or are you home call? And the frequency of these calls are important things to consider when selecting a program. And then for this category, lastly, will be how is your general surgery training distributed amongst your vascular surgery training? Are you doing your first 18 months of general surgery at the beginning without vascular, or is this integrated throughout your junior years of training? Most vascular surgery programs will have the final 2 years exclusively as vascular surgery training. And then the last two factors to consider are intangible factors and just overall, how do you fit in with this program? How do you get along with your co-residents? The variety of staff and their interests. For example, what type of research do they do, and are they able to include you in these activities? And then something that I find particularly important is how do you get along with your program director? Do their vision for the program align with your expectations as a resident? And then you put all of these factors together to kind of come up with a work-life balance in the setting of being a surgery resident. Thank you so much for listening. And of course, I'll be available during the breakout sessions if you guys have any questions. Thank you.
Thank you, Dr. Villanueva. Dr. Murphy.